But if you're feeling like you're just not looking your best, then you're going to want to watch this next story. I went to Dr. Pennoyer's dermatology office to learn about some newer non-invasive techniques to help you look your best from head to toe, or in this case, from ears to hands.
You'll see what we mean. Take a look.
Wanting to look younger is a common goal for many patients who come to Dr. Pennoyer's dermatology office in Bloomfield.
You know, we try to create a customized treatment protocol, and that's customized to each patient's needs.
A lot of the anti-aging procedures require injections, and at this office, you're in the right hands.
I am proud to say I am an expert injector, and you know, as a board-certified dermatologist, I get given a lot of things to correct from people who aren't practicing within their specialty and putting their patients at risk.
When we think of injecting fillers, the face or lips come to mind. But today, Dr. Pennoyer is showing us two other areas that can gain a more youthful look.
Felice came to me because she doesn't like the look of her hands, feels they make her look older than she is. And it's true, it's one of those soft signs of aging. You can lose your sub-Q volume, and you lose the skin elasticity, and you've got these big dilated veins. So it really is the giveaway of your age.
It just happens?
It does happen on all of us. That's normal aging.
Sun exposure and sun damage are two things that contribute to this. So the more you've had, the faster your hands will age.
Was it something that was bothering you, Felice?
Well, I have a couple weddings coming up, and it was bothering me.
Luckily, Dr. Pennoyer has a pretty quick fix for Felice's hands using a filler called Restylane.
So even by tomorrow, will she notice a difference?
She will notice a difference today.
Today? Oh, excited?
Yeah.
First, Dr. Pennoyer applies some numbing cream, and Felice sits with it for about 10 minutes. Next, it's time for the filler. Dr. Pennoyer fills the hollow areas of the hands. After one hand is done, there's already a huge difference.
It's filled her in, so it just makes her hand look younger. You don't see all the structures, the tendons and the veins so much.
Right.
It just looks better.
Yeah, I mean, instantly you can already notice a difference.
After the second one is complete, Felice can go right back to her usual day, just taking a few breaks to ice her hands.
Just obviously protect with sunscreen. Keep out of the sun.
And so again, this will last how long?
10 months to a year.
Okay. Felice, what do you think?
I think they look great.
Meanwhile, Stacy came to the office for a different concern: sagging and flattened earlobes due to years of wearing heavy earrings.
Most women believe they would love to fix their faulty earlobes from the heavy earrings. So over time, those heavy earrings really cause that opening to droop. So what we're going to do is we're going to have Stacy take out her earring, but we're going to put filler in below and around it to really kind of make that more rounded, give it more support, make it look like a real earlobe again.
It really bothered me. First of all, I can't wear half the earrings I own because my ears droop so much, and I always feel embarrassed by the way it looks.
Same as with the hand injections, a little numbing cream goes on for about 10 minutes, and then Dr. Pennoyer injects some filler around the earlobe. In seconds, it goes from flat to round again.
We've added some volume, made it a much more rounder, plumper earlobe that's going to support a much heavier earring.
I mean, that's a huge difference. Looks great.
She's going to ice now for a good 10 minutes, ice 2 more times tonight, and then again tomorrow morning. I don't want heavy earrings for 2 days, but she can go on with her life.
Are you excited?
I am. I'm really excited. I've wanted this done for a long time. It's really bothered me, so yeah.
Do you feel like you'll feel more confident?
Oh, absolutely, yeah. And I can wear all my earrings that have been sitting in my jewelry box.
And it's not just middle-aged women coming in these days to look their best.
You know what? There's a lot of prevention. We have more and more millennials coming in that are trying to get ahead of the wrinkles and sagging. And that's really smart to get ahead of it. You don't want to wait too long.
Dr. Pennoyer tells us about another newer procedure that uses human growth factors taken from a person's very own blood. Combine them with microneedling for facial tightening and rejuvenation.
We could also use that and inject it into the scalp and grow your hair. And so there's a protocol with that as to how well that works. And that's been working great.
Unbelievable.
Yeah, really, big difference there. All right, Dr. Pennoyer is running a special on the hand rejuvenation. That's going to be in the month of November.
Dr. Pennoyer's office is on Jolly Drive in Bloomfield. The website is drjenniferpennoyer.com. All right, after the break, we're going to be talking tailgating the easy way
Yeah.
with some really good food.
And later in the show, 2 of the stars of Murphy Brown are talking about the show's comeback 30 years after it debuted.
But before we talk to the actors who played anchors on TV, we're going to send you on over to Studio A, where our real anchors are going to give you a check on today's latest news and weather.